So this is a little diagram that gives you an idea of where we're heading. So while we talk about a two-hospital model of care, there's actually more than two sites to Mackenzie Health, and we actually have many community sites where the service delivery of healthcare is probably more appropriately delivered in the community and outside an acute care setting. So places like you see on this diagram house some of the services that are more appropriate in the community, such as outpatient dialysis, diabetes education, and these things are probably more appropriately delivered in community setting, even though we talk about the two hospitals that we're going to be going towards. Now this is a busy slide, but it does give you an idea that there are going to be some services that are going to be core and going to be essential provided at both hospitals. So in orange at the top, you'll see that at both Mackenzie Vaughan and Mackenzie Richmond Hill, there'll be two full-service emergency departments, two intensive care units. There'll be medical imaging, x-ray services at both sites, pharmacy, there'll be surgery provided at both hospitals, and lab and inpatient beds as well. But with the expansion and the new Mackenzie Vaughan Hospital, this will allow tremendous improvement and even subspecialization and be able to do certain things that we are not able to do now just at the Richmond Hill Hospital. So things like seniors and chronic disease will be able to expand and improve the service at Richmond Hill. Chronic kidney disease, which is a major focus of the service delivery that we provide, is going to be even enhanced, as well as complex care at the Richmond Hill Hospital. While the Mackenzie Vaughan Hospital will be able to super specialize in areas like district stroke, even though we already are a district stroke center, we can provide even more specialized service and enhanced service with the new Vaughan Hospital. Birthing and obstetrics will be improved, and I'll give you a little example of what it's going to look like at the Mackenzie Vaughan Hospital. And of course, pediatrics goes along with the obstetric program generally and a maternal newborn program, and mental health will also be provided mostly at the Mackenzie Vaughan Hospital. So here's a little bit of a scenario of a patient, a fictitious patient, so you can get an example of what it's going to look like and what the improved care experience will be. So for example, we have this 66-year-old woman who's brought to the emergency department at the Mackenzie Vaughan Hospital with signs of a stroke. And she's immediately assessed, and the diagnosis that she is having a stroke, and TPA, which is a modern clot-busting drug, is administered quickly within only a few minutes, and she starts getting her immediate care right away. She's then admitted to an integrated stroke unit, and she receives her acute stroke care, as well as the beginning of a rehabilitation while she's still in the same room. This is something that can't be done currently. This is an enhancement that we're proposing for the Mackenzie Vaughan Hospital. And of course, she's going to be admitted to a private room because 80% of the rooms will be private. Single patient rooms, which enhance patient care in terms of infection control, as well as a much nicer environment to be admitted to hospital. Every room will have a 3-piece bathroom, which also will enhance the ability to provide infection control and keep things to one bathroom per one patient. The patient record will be completely electronic and be available at the bedside, so that all the information that is being documented for that patient care stay in the hospital will be instantly available to others in the organization, as well as to community sites such as family doctors will be able to access that information as it's being documented. Another example, this is an individual who, a 22-year-old man, comes into the emergency room at Mackenzie Richmond Hill Hospital, and he comes in with abdominal pain, and he's assessed by the emergency doctor. He undergoes tests, including a CT scan potentially, and he's diagnosed with appendicitis. And so he's booked and gets everything prepared and gets his emergency surgery later that evening through the laparoscopic approach, and he stays overnight, and the following morning is well enough to go home. He's discharged home, which is pretty much the standard care now, and hopefully with the new capacity in Mackenzie Vaughan Hospital and 2 emergency rooms, this patient who's being treated very well at Richmond Hill Hospital is going to be treated hopefully quicker with less wait time and less complications of that wait. So here's another example. This first-time mother is referred to Mackenzie Health Pregnancy Assessment and Genetic Clinic for prenatal screening, because in the Mackenzie Vaughan Hospital we'll be able to have specific maternal fetal medicine. And this individual, these tests are done and they find that there may be a little abnormality, but she's referred quickly to a specialist in that area who reassures her that those testing results are nothing that she has to be worried about, and it's not a major concern. And so, of course, a healthy baby is delivered at the Mackenzie Vaughan Hospital in the new LDRP room, which stands for Labor, Delivery, Recovery, and Postpartum. So the future plan will be that this woman gets admitted and stays in the same room from the time she comes into the hospital to the time she's discharged. She has the baby in the same room, recovers in the same room, a private room, with the capacity to have her loved one, her husband, significant other, stay in the room with her. So this is something that's a tremendous enhancement to what we're doing now. These rooms will also have jacuzzi tubs, which aids in the delivery of the baby. And so this is a really new, modern, futuristic type process that exists right now in certain areas, but nothing that we can do right now at the Richmond Hill Hospital. Mackenzie Health will also have a level 3 NICU, which stands for Neonatal Intensive Care Unit, and which will also have private rooms. Right now, all the babies in the intensive care unit are in isolates in one big room. Here, they're going to be separated like the adult ICU. They're going to have separate rooms where the mother or father or family can stay overnight in that same room as well. So a huge enhancement to patient care. Chronic disease management, another major focus in terms of what we do, not only the acute issues. And so here's an example of a 55-year-old gentleman who arrives at Mackenzie Richmond Hill Hospital Emergency Department with some abdominal pain after coming back from a trip to Cuba. And he gets seen in the emergency room and he's assessed, and they find that it's nothing too serious, but on the routine blood work they find that, his sugar levels are a little bit high. And so immediately he's tapped into the process and to the clinics and follow-up. He gets his appointments done, and they find that his kidney function is already deteriorating already. So he's diagnosed as a new diabetic. He's hooked up into the diabetic education clinic. He gets all the counseling for diet and management, and he also gets hooked into the pre-renal insufficiency clinic. So hopefully, in a way to get the best possible treatment, best possible care to delay the potential onset of his kidney deterioration and hopefully prevent him ever having to go on dialysis. And that's the eventual hope for him. So that's a little bit of an example of the type of patients and how they're going to be treated differently from what we're doing right now.